Hello, this is Dr. Ade again. I hope you've had a good day. And today we're going to discuss polycystic ovarian syndrome. It has a new name now. It's called polyendocrine ovarian syndrome or polyendocrine metabolic ovarian syndrome. It's a combination of symptoms that you would present with, and one of them is infrequent periods or no periods at all if it starts in puberty, or rather irregular periods. So that's the commonest symptom people come in with. And the next thing is they can have generally a raised BMI. Not to say there aren't lean people with polycystic ovarian syndrome, but generally they have a raised BMI. The next thing is raised male hormones, which results in hair on the chin, hair on the upper lip, sideburns sometimes, hair on the abdomen, on the thighs, generally places where you don't expect to grow hair for women. Okay, so when you see that happening with your daughter or with yourself, or your periods are infrequent, come in to see your GP. You don't have to accept it. It may not be normal at all. Some people, don't get me wrong, some people have a pattern that they're used to with their periods, and that's fine as long as your hormone levels are all right. What we tend to do when you come in is to check your hormone levels. Now, the next reason people present actually is infertility. So they're trying to conceive. It's a very common cause of infertility because if you're not having periods, the chances are you're not ovulating. There are some people that have regular periods and are still not ovulating, but the chances are if you're having irregular, infrequent periods, you're not ovulating. When you do have periods with polycystic ovaries, it can be rather heavy. Can you imagine not having periods for 6 months and then bleeding? Yes, it can be quite heavy. Not necessarily painful, but heavy. Now, so what we tend to do is we run a lot of tests because our concerns, apart from the fact that you're not having periods and possibly not conceiving, is more later in life. So things like diabetes are common in polycystic ovaries, so we want to find out sooner so we can start to put health style measures in place. Hypertension can occur in polycystic ovarian syndrome as well. The other risk with polycystic ovarian syndrome is hypercholesterolemia. So we have raised cholesterol levels, especially the bad cholesterol, the LDL cholesterol. So what I want you to do, if you notice these symptoms, is please let us know so we can at least run the test and start putting preventative measures. Remember, we're talking preventative measures to protect your cardiovascular system. Nice talking to you again. See you soon.